Lucy, can you tell me when you came for your first pregnancy treatment with me, what it was you were hoping to get from it?
I was hoping to just be a little bit more relaxed for my first birth, obviously being a bit nervous first time round, and to maybe start my labour, because I was overdue by that point, by about a week and a half.
Okay, so tell me, what did we do with you?
You were amazing, Dawn. You totally relaxed me mentally and just got me in a really good space, ready for the arrival of my first baby.
And did I use...
Which was amazing. I've never used reflexology before, but afterwards I was completely convinced that it definitely tapped into an area that just to get me ready for labour. Really.
And your first child, you had a natural labour?
I was induced in the end, but it was as normal as it could be, as any birth could be.
Brilliant. Okay. When you say you experienced a feeling of being very relaxed afterwards, can you tell me, was it just reflexology that achieved that, or what other tool was it?
I think
that
the
helped?
reflexology did, but also you're just talking things through to a third party that isn't, connected to the whole situation makes a massive difference. And someone just who's going to listen, listens very, very well.
So here we are, Lucy, 2 years bar 11 days after your first birth, and 10 weeks ago you had your second. Now, I didn't see much of you in pregnancy treatment-wise, although we have been in touch and just keeping check of progress. And this time, we've done a very different pregnancy treatment. So could you tell me, first of all, what you asked me for that you most needed?
I needed, obviously, second time round, way more exhausting with a 2-year-old in tow, as you can hear. Afterwards, I was absolutely worn out. 10 days on, your body feels achy, absolute exhaustion, because you're running around after one and looking after a new one. I just wanted to be de-stressed, and you just gave me the best massage, which actually, when you're breastfeeding, was just fantastic. It just relieves all the pressure that you get, your achy back, achy shoulders, and you just feel like the most run-down person on the planet. And getting a massage and having someone just take a little bit of time for you is, it's just a luxury, isn't it?
But should it be a luxury?
It shouldn't. It should be a necessity. It should be on the NHS.
It should be a necessity. So this treatment, right, Lucy, with your second child, actually was looking at your tension and pain in your shoulders. From previous lifestyle or incidents, would there have been anything that would have caused that tension?
Yeah, I've had a previous accident when I was a child, and just lifestyle situations and sports that I do, extreme sports. Obviously, you put your body through it, and being able to release some of that tension, I hadn't realised had been there for a long time, was really, really therapeutic.
And how did the massage help bring that out?
Dawn was very, very good at she's obviously an expert in her field when it comes to massage, but also an expert, I would say, in tapping into what happens to be the issue that's going on and creating that tension in your body, and being able to release it, whether it's keywords or just discussing it at the same time, but just letting you be peaceful and allowing it to happen.
It kind of sounds like some counselling session. Is it?
But it's not like a clinic. I wouldn't call it that. It's not that clinical. It's more like having a really good friend listen to you and get it and know how to sort it for you.
So 2 last questions. Would you recommend me to anybody?
I would recommend you to everybody.
It's to everybody. How can I help everybody?
I would say everybody
So
should
all in all,
Dawn. Brilliant.
thank you very much.
You're welcome.